Hey, welcome to Quiet Colleagues at WHSK. This is Molly at Commonwealth University Bloomsburg. So, today we live in a world that's very technologically driven. Advancements are happening every day, whether we notice them or not. And within the recent years, there's been a surge in this new kind of technology, and it's gained a lot of popularity. And that's artificial intelligence, better known as AI. So, how exactly is AI used in healthcare? Well, it's used to help diagnose, chart, and take away the burden of administrative tasks. AI has been integrated into the electronic health record to help support nursing workflow at the bedside and allow a pre-population of tasks that need to be done related to patient records and assessments. Epic, which is one of the major charting systems, is partnering with Microsoft to create a tool that records nurse patient interactions and smart charts for the nurse and then uploads the relevant subjective information which the patient gives them into the platform, which then the nurse can review and then submit to be filed within the patient chart. So, how can this technology be introduced to the world of education? Well, professors are allowing students to create their own exam questions based on the learning content that they are going to be examined on. And they are often seen heard promoting the use of AI as a study tool and not a reliant system. There's been a crackdown within the recent years within the education system with students using AI to write their papers and using AI to complete assignments for them, and it's causing professors to put AI clauses not only within their syllabi, but within department policies as well. The American Nurses Association released a statement regarding AI, stating that they approve the use of AI. However, nurses must use it in an ethical and responsible manner. The American Nursing Journal published an article that addresses the challenges with AI in education. And one of those statements stated that AI does not challenge students' critical thinking skills, in which that is a critical skill for a nursing student to develop as they go through schooling. So, is AI worth the risk versus the reward in nursing? Based on the research that I have conducted myself, it depends if the technology is going to be used in a sense of integrity within the purpose of caring, honest, and trusting practice, like the ANA statement and recommendations. I believe that AI is not to be misused within the education system to complete assignments with immoral principles, and it is not to be misused within the healthcare system to diagnose and treat patients. Doctors and nurses should not rely on AI technology to diagnose a patient without ever seeing or assessing the patient. A healthcare provider should always, always conduct their own assessment. AI was made to be a helping hand and not take over. The more we allow AI to do things for simple reasons because we ourselves don't want to, the more we allow the narrative of AI taking over to actually take over. If AI is going to be a core aspect within the healthcare system and the means of charting, workflow, efficiency, there needs to be regulations to make sure that the PHI, or personal health information, is not being misused or can easily be hacked since it would be recorded. Healthcare systems need to increase their internal and digital security to ensure that the PHI is safe. We live in a society where if hospitals' internal network goes down, the hospital simply cannot function. This type of issue should be prevented and monitored at all costs to make sure that this does not happen, and upgraded security and added regulation needs to happen. So my final thoughts are, overall, AI is something that is used to help ease the burden of mundane tasks. However, it should not become a tool that healthcare workers, providers rely on. In my personal experience, yes, charting is tedious. It is one of the most mundane things that we do. However, it is essential. It is very important to remember to still practice with a strong practice stewardship. We should rely on research in our practice and contribute to the quality of healthcare. Always know your state's practice laws and never do something outside of your scope of practice, even if AI or a physician tells you that it is okay. And always, always, always remember, if it is not charted, it was never done. So, thank you for listening to this week's episode, and I encourage you to do your own research to make your own evidence based opinion. This is Molly signing off.